There's so much information out there on breastfeeding versus formula feeding. Is one option healthier? What happens if you can't nurse? And is this decision going to have ramifications in the future? Dr. Michael Wasserman is here with pros on both sides of the fence for parents trying to decide what route to go. And first of all, if you're breastfeeding, it's recommended that you do that until 1 year old.
You should breastfeed as long as you enjoy it.
Okay.
Certainly, if the world is perfect, you would breastfeed until age 1.
Okay.
But I want my moms who are doing the breastfeeding to be happy doing what they're doing because they're enjoying it and their baby's growing and developing well and things are being successful.
Okay. But after 1, you need to cut it off.
Some women choose to breastfeed beyond age 1, and that's a very individual decision. Certainly there are different issues that go into here, some of which are dietary and nutritional, some of which are the psychological and social interaction between mom and child. So it gets to be a complex conversation, and usually the moms decide on their own, I want to breastfeed a week, a month, a year, or longer. And I'm there to support the parent. Again, as long as the baby is growing and developing well, then I'm happy with all choices.
And let's start with the advantages of breastfeeding.
Well, first of all, understand that breastfeeding is clearly nationally recommended by my national professional group, the American Academy of Pediatrics, until age 1. Why? You can see it on the screen. There's a whole host of reasons. The baby gets immunity from the breast milk that is specific to the baby. Mother's milk can be more easily digested than any of the formulas. There are some statistical relationships between breastfeeding and having a lessened risk of SIDS, sudden infant death syndrome, of the baby maybe having a slightly higher IQ. There's a lessened risk of some other diseases which range from immunologic problems to even some types of cancer and infections and so forth. So really, breastfeeding has its advantages that are clear, but this is when you look at populations of children. So if you look at 10,000 children that are breastfed versus 10,000 children that are formula fed, the kids that are breastfed clearly have a leg up on the population. But you're not interested in 10,000 children, you're interested in your child. And that's where it all comes down to. So just because you choose or can't breastfeed successfully, excuse me, it does not mean that your child's going to have these problems. And in fact, that's an important piece here. The other thing, of course, is breastfeeding is less expensive. And you never run out of it. And you don't have to go to the grocery store at 2 in the morning. But certainly, just because you choose to formula feed, if indeed that's your choice.
Yeah, let's talk about the advantages of that.
Well, the big advantages of formula feeding are that, number one, you can have your partner involved. As a dad, I like at times being able to give one of my children a bottle, whether it's a bottle of express breast milk or a bottle of formula, but it gives other people in the family an opportunity to interact with
to bond.
To bond. You don't have to pump. And some women find pumping easy. They're at work and they need to do that. Some people find it more difficult. It's really up to the mom and how she feels. It's a little bit easier to schedule feedings when you formula feed versus breastfeed. But not necessarily, and again, it depends on the interaction between mother and child. There's no special diet that the mom has to follow. So sometimes there are babies who may be sensitive to cow's milk. Mom drinks a glass of milk or has a bowl of ice cream or whatever, dairy, that can cross into the mother's milk and that can impact the baby. So moms sometimes have to pay attention to their diet. More often than not, they don't, but sometimes they do. And of course, when you get into the issue of alcohol, mom will say, I didn't have a glass of wine for 9 months, and boy, I really crave it. And they say, oh, I'm going to breastfeed, and then I'm not going to choose to do alcohol during the time that I'm breastfeeding. An option, of course, is to have some alcohol, pump your breast milk, discard it.
Do you just discard one?
You might discard it for 4 to 8 hours of time.
4 to 8 hours, okay.
But if you have some milk that you've saved in the freezer or the refrigerator, then you can use that instead. So really, it has to be individualized. The hard part with breastfeeding is getting started. It's getting through the part of having the nipple change so that it's ready to do work, having the milk come in, have the baby and mom learn to do this, and make sure that that's a comfortable process. It typically takes about 5 to 10 days for that to occur, and that's where the pediatrician comes in, and he or she is there to help you, to walk you through this process, hold your hand, make sure the baby's doing well, because you don't know how many ounces you gave the baby. You put the baby to the breast, you have no clue, and it's very disconcerting, understandably. But we all want to make sure the baby's going to be fine.
A lot to think about. Thank you very much.
You're welcome.